Hi, thank you for joining me. My name is Anil Tailor. I'm a consultant gynecologist. I practice in the UK. This is a short video about why women who are eligible should have smears on a regular basis, why that is important. So, to understand cervical smears, we need to first of all understand what we're trying to achieve by carrying out regular smears. So, cervical screening, as that is what is called, is what it is trying to achieve is to try and detect cervical precancer. A lot of women wrongly believe that smears are there to detect cervical cancer. Yes, smears occasionally do pick up cancers, but that is rare. And if you think about it, picking up cancers is perhaps detecting something when it is perhaps too late. So the right time to detect the problem is when it is still at a precancer phase. And so that is essentially what cervical smears tries to achieve. So therefore, by definition, if you yourself have recently received a letter to say that you have an abnormal smear, please don't panic. It just usually means that what they have found is some precancer rather than cervical cancer. Precancer is quite common and it can be easily treated, usually just takes 5 minutes. And often the low-grade smears don't even need any treatment. They're just monitored. So who is eligible to have smears? So in England, where I practice, women between the ages of 25 and 64 are eligible to have regular cervical smears. So these women automatically get sent invitations to go and make an appointment with their GP or practice nurse to have this smear taken. Should women below the age of 25 be having smears done? Now, in years gone by, yes, that used to be the case when it was considered that once somebody had started sexual activity, that they are then at risk of cervical precancer and cancer, and that therefore they should be eligible for screening. But over the last 10-15 years, the new methodology is to invite women after the age of 25 or starting from the age of 25. So the argument there is that yes, women who are younger than 25 will have precancer, but because the transition from precancer to cancer takes a good few years, the vast majority will not develop any cancer, and actually by the time they are invited for their first smear, their precancer will be detected and be treated, and that therefore they will never actually develop a cancer. Yes, of course, there is a tiny minority of women who do develop their cancer before their first screening smear is due, but on the whole, that is rare. What about women after the age of 64? Do they need to continue having smears? So again, these women can quite safely stop having smears as long as their smears, especially in the later years, have been normal. Women, if they've never had an abnormal smear, are at a very low risk of developing cervical cancer after the age of 64, and so they can safely stop having smears. So the women who should consider continuing with screening are those who have had abnormal smears in their later years, or somebody whose partner may have changed. So perhaps they could continue screening. But otherwise, on the whole, it's just the age group between 25 and 64. How often are smears done? So for the age group between 25 and 50, the smears are done every 3 years in the UK. Of course, there are many countries, many other countries where they're done much more frequently, but it's actually not necessary. Research from the UK has shown that the pickup rate for the precancer or cancer is not enhanced by doing them any more frequently. Those between the age of 50 and 64, their smears can be done every 5 years rather than every 3 years. Of course, if there is an abnormality, then they're done much more frequently. So are all eligible women actually coming and having their smears done? You might think that they do, but actually it is not the case. Out of all the invitations that are sent out, about 70% take up the invitation and go and have the smear done. So there are about 30% of women who ignore that invitation and don't have that smear done. And as you can see from this graph, the trend is slightly worrying in that fewer and fewer women are coming to have their smears done. Hopefully, we might see a change in that trend. So when you do go and have a smear done, what's actually involved? So what happens is that usually it's the practice nurse who sees you, and they will do an internal examination where they will put in a speculum into the vagina to expose the cervix. And once the cervix has been visualized, then they will use this plastic, gentle, soft broom that will then be used to wipe some cells off the cervix, some cells and some secretions off the cervix, and that will then be deposited in this vial. This vial contains some fluid, and so the cells that have been captured from the cervix will then float in this fluid. Now, this specimen is then sent to the lab, and the lab can do two things with this specimen. Now, about 10-15 years ago, all the specimens used to be put on a slide, and the cells were then examined under the microscope to look for any changes in the shape and size, and that can give information about whether there is any precancer. And that is called cytology. So all cervical smears had the cells looked at. But that was 10-15 years ago. Now what happens is that the specimen, when the lab receives it, it essentially looks for the virus, the HPV virus. And it's the virus that causes precancer. So if the virus is not there, then the assumption is that precancer cells will not be there. And therefore, no point looking for those abnormal cells. Now, HPV, there are about 200 subtypes of these viruses, and they can broadly be categorized into two groups, the low-risk category and the high-risk category. And it's really the high-risk category that have the potential to cause high-grade abnormality and also subsequent cancer. So those with a low-risk HPV, they almost never develop high-grade precancer or cancer, and that therefore these women are basically told that their smear is normal. So essentially, from the specimen, they look at the HPV for the high-risk HPV, and if the high-risk HPV is present, then they will put the cells on the slide and look at it, and then try and grade whether the cells look normal or whether there is a low-grade abnormality or a high-grade abnormality. And depending on what is found, they will then decide whether the patient, the woman, needs to be referred for a colposcopy examination. Are there any women who don't need to have smears? Okay, so there are, of course, a lot of women who will have had a hysterectomy. Now, if they have had a total hysterectomy is where the womb and the cervix have been removed. If they've had a total hysterectomy, then most of these women don't need any smears. If they've had a subtotal hysterectomy is where the top of the womb have been removed, but the bottom end, meaning the cervical end, is still has been left behind. So those who have had a subtotal hysterectomy who still have a cervix, of course, they need to continue having their smears. What about women who have had an HPV vaccine? Can they stop having smears done? The straight answer to that question is no. These women should continue having the smears when they're invited. There is some research coming along that is seeming to suggest that perhaps these women may require fewer smears through their lifetime. But at the moment, the advice is that they should have the screening in the same way that a non-vaccinated person has. So why do some women not have their smears when they're invited? Now, there can be a variety of reasons. They could be, they perhaps just don't have the time to go and have the smear done, or they feel too embarrassed to have the smear done, or they have had a previous bad experience whereby their previous smear perhaps caused them a lot of discomfort or pain, and therefore now they've decided they're now not going to have the smear done, which is unfortunate. Other reasons can include, for instance, a computer glitch occasionally, because the details of all women who are eligible, they get invited through the system, and if the woman has somehow fallen through the net, then an invitation doesn't get sent out. That, on the whole, doesn't happen that often, but occasionally does. What is the consequence of not having regular smears? Well, hopefully this should be obvious. As we said earlier, a smear is trying to detect a problem at its earliest pre-cancer phase. And if you don't have smears, then, of course, if you do have a pre-cancer, that could slowly progress and eventually develop into a cancer. And at the first, you will know that there is a problem with, say, irregular bleeding or irregular discharge or problems like that, then that could spell a much bigger problem. Because remember, precancer, in most cases, does not cause any symptoms like irregular bleeding or discharge. So it is logical to go and have the smear done when you're invited, because that could save you a lot of heartache, because a precancer is very easy to treat, takes literally 5 minutes in clinic under local anesthetic, whereas a cancer is heavy-duty surgery. So it is worthwhile having these smears done on a regular basis. So thank you very much for watching this video. I hope you found it helpful. I have other videos that are on a similar topic. Please search them out. And if you found it useful, then please consider subscribing or clicking the like button. And I will see you with my next video. Thank you. Stay safe in the meantime.